Hello, welcome to It's Your Life. I'm your host, Dr. James J.C. Coolin. Wow, we got another absolutely magnificent show coming your way today. We got this young lady that's our guest. She wears, I believe, about 8 different hats, from pharmacist to internal medicine to dash. I'm talking about it. When you talk about the medical field and you're talking about health, this young lady right here that we got on the show today is this is what it's all about. And so I'm excited to have on the show. I know I ain't gonna get to Michelle right now because I want to lock in all 68 platforms at the same time. And hey, Todd, how you doing today, man? How you doing, man?
I'm always good, James.
Hey, man, can we get ready to lock all these platforms in because we got a show for.
Let's lock them in.
Let's do
it. Your Life is sponsored by James J.C. Cooley.
Hello. Welcome to the James Cooley Show. It's Your Life. I'm your host, Dr. James J.C. Coolin. And I tell you what, I'm excited about today. I hope everybody is having a wonderful, wonderful day wherever you're at. Michelle and I, we're in Texas right now. We'll be back in home, back in California in a couple of weeks. And I get a chance to hang out with my great producer, Todd T. How you doing, Todd?
I'm good, James. How you doing?
Man, I'm excited, man, because, when it comes to health, when it comes to fitness, when it comes to a lot of things that I believe that we all should be focused on. And we all need to have an understanding of certain things we put in our body, certain things that we need to do, certain adverse activities that when we put the wrong things in, certain things that occur when we don't do the right things, like getting up and working out, and doing all that. I got my 6 miles in today. This guest today is going to talk about all those things. But you know what? I cannot ignore the executive producer and the co-host of this show any longer. How you doing, Dr. Cooley? How are you doing today?
I'm doing great. This topic is really about the items that people take when they want to lose weight. And the holiday season's coming up as well, but this is in general, 365 days a year. This is about what the additional substances, aside from working out, this is about the substances people are putting in their body to lose those extra pounds. So that's where this focus on the show is about. And we have this amazing doctor who's going to break it down for us.
Well, I'm excited because I don't want to put the wrong things in my body either. And I certainly don't want our viewers and our listeners to put the wrong things. I tell you what, whichever platform that you are watching us on, whether you're watching us on E360 TV, Transfer TV, YouTube, LinkedIn, Twitter, Facebook, Rumble, or over 68 live platforms. Welcome to the show. If you're just listening to us on the radio, KCBQ, AM 1170 Answer, FM 96.1, Spotify, iHeartRadio, and many other live platforms, welcome to the show. You can be part of the show 2 ways. If you're watching us, just go to the comments on the platform that you're watching us on. Ask any questions that you might have. I promise you that we'll get you an answer. If you're listening to us on the radio or listening on other platforms, all you have to do is pick up the phone and dial 1-888-344-1170. Again, that's 1-888-344-1170. Dr. Michelle, can you please do the honor and introduce the title of the show, purpose of the show, and bring this absolutely magnificent guest on?
Oh, most definitely. So the title of today's show is called Trading Pounds for Health Problems. And we're having a conversation with Dr. Swathi Varanasi-Diaz, Pharm.D. She's an integrative pharmacist and natural medicine specialist. She's going to talk about the major red flags associated with GLP-1 weight loss drugs, accelerated muscle loss, mental health side effects, gastrointestinal issues, and off-label misuse. So she is known as Dr. Swathi to audiences. She's an award-winning healthcare professional recognized for her trailblazing work at the forefront of personalized medicine and healthcare innovation. She earned her Doctor of Pharmacy degree from the Medical University of South Carolina and became the first pharmacist in the United States to complete a postdoctoral residency in integrative medicine and preventive health. Following this achievement, she co-founded the Integrative Health Pharmacy Residency Program. Her credentials also include a postdoctoral fellowship in biotech and nutrition from Cornell University. Oh, wow. Scientific and medical advisor and consultant with many innovative companies, including Misuse. Her research has been published in peer-reviewed academic journals, and she is so much more. Give it up for Dr. Swathi.
Thank you so much for having me.
How you doing, Dr. Swathi? How you doing today?
I'm great. I'm good. Having a good day. How about you?
Oh, wow. Having a wonderful, wonderful day here. And it's so excited to have you on the show to talk about things that we need to be aware of. I believe that I'm not going to say everybody, many of us are kind of health conscious in a sense, or we might not be. Many of us want to do the quick thing to lose weight and not know what the side effects, not clearly understand any of that stuff. So this is perfect for what we need to convey to our audience today. So let me start off like this. Can you tell our audience and our viewers a little bit more about you, where you grew up? When did you decide that this is what you want to do? What makes you click, and why? What is your purpose? Why your purpose is to identify certain things that might be harmful to people that are trying to get the lose the weight quick scheme?
Yeah, so for me, it started very early on. So, I grew up in a household in which we thought of food and herbs as medicine. That's, the practice of Ayurveda. So I grew up in that initially and was thinking, what can I do to, help as many people as possible? And so for me, healthcare was the clear fit. So I tried a lot of different avenues, and I really felt like pharmacy was one of the best for me, simply because of the access that you have to patients. So not only can you answer questions in a pharmacy setting, you can also work in so many different ways, whether that's, beyond the pharmacy. So you can work in the hospital, you can work in biotech or the pharmaceutical industry. And at the end of the day, what really drew me to what I do now and the specialization I have in integrative medicine and preventive health is, how can I help a patient with their overall quality of life? And I think that is my core and my absolute favorite thing to talk about, and how I think I can help people the best is, yes, you can include these drugs. Yes, you can potentially include nutrition, supplements, movement, all these different things. But at the end of the day, what does the patient want to achieve, and how can I help them get to their goals?
Wow. And so many people, as you know, we got Thanksgiving coming up. We got Christmas, New Year's. We got all of these holidays that are coming up, and a lot of people want to do whatever it takes other than actually get out there and eat right, and make sure you get the right nutrition and also exercise to lose weight and to get prepared in their minds for these holidays. So my question to many of people are either trying to control their weight during the holiday seasons, especially losing weight after the holiday season. And you already know that. Why did you want to talk about this? Because obviously that is a trigger, and we want to educate them right now.
Yes. And I mean, there are so many different ways that we can do this. As you mentioned, there's the nutrition, there's the movement, there's supplements. But what is really popular right now are these GLP-1 agonist prescription medications. So you might know them better as Ozempic or Wegovy or Mounjaro, or, there are a lot of different names. But at the end of the day, they're all the same class of medications. And so GLP-1s have really just, in the last few years, you just see them everywhere, whether you're getting them from your healthcare provider in the office or you're getting them from a telemedicine provider. And so, the way that these drugs work and why people are so interested is initially all the research around it was actually to manage blood sugar. So the first FDA approved product in this category, Ozempic, it's actually for type 2 diabetes patients. So it's FDA approved for that. But a lot of people are using it for them not having diabetes. And then since then, they've noticed that people who are taking these medications for diabetes are losing weight. So they looked into it more and realized, oh, I guess we could actually do an FDA approved product with the same active ingredient, but a higher dose, so that we can have people take it for weight loss. And people have seen upwards of 15 to even 20% of their total body weight lost.
But so it is FDA approved.
Yes. So
as you mentioned, for another issue. And now, I guess the powers to be, the drug, the pharmaceuticals, is saying, okay, we can do this as well.
Yes, exactly. So there are FDA approved versions. I'm sorry. There are FDA approved versions that are for type 2 diabetes, and then FDA approved versions with a same or similar ingredient, but are FDA approved for weight loss. So at least they're FDA approved, but the thing is, they're only FDA approved for very specific patient populations. So you either need to have a BMI of 27 and another condition, so another condition that can worsen your diabetes, or you need to have a BMI of 30 to even qualify and have insurance cover the use of these medications that are FDA approved.
So BMI, can real quickly before we take the break, tell our viewers and our listeners, what does that mean?
Yeah, so your BMI is pretty much, it's one of the biomarkers or one of the ways that your healthcare provider can assess, how much fat to, other tissues you have in your body. And so for that reason, that's what's generally used to determine if you are normal weight, underweight, overweight, or obese. So 27 denotes that you're overweight and 30 denotes that you're medically obese.
Hold that thought. Because we have to take a station break, but that is so important to where we have to come back and reinforce and re-educate the audience on that, because that's going to set the stage for the rest of the conversation. I tell you what, whichever platform that you're watching us on, if you want to be part of the conversation, all you have to do is just go to the comments on that platform, ask any questions that you might have. I promise you, we'll get you an answer. Or you can pick up the phone and dial 1-888-344-1170. Again, that's 1-888-344-1170. My folks back in KCBQAM 1170 FM 96.1 studios, Toddy will put you through and you can become part of the show. It's your life, and we'll see you shortly after the break.
There's more stories of greatness to help you overcome adversity coming up on It's Your Life with James Cooley.
A black man's point of view.
Noah Dingley here, producer of The James Cooley Show, It's Your Life. And the new audio version of James' book, Country Boy, City Boy, A Journey That Ain't Over Yet, is a must-have. James shares his true life story of struggle and success in America. It's both a cautionary tale and a roadmap to achieving the American dream. Get the new audio version of Country Boy, City Boy, A Journey That Ain't Over Yet by James Cooley on Amazon.com or wherever audiobooks are sold.
Hello, welcome back to the James Cooley Show. It's your life, and I tell
Encourage
y'all,
and enlighten our next generation of leaders and heroes. Get your copy of Country Boy, City Boy, A Journey That Ain't Over Yet by James J.C. Cooley, available on Amazon and everywhere books are sold.
It's the James Cooley Show. It's your life.
hello, welcome back to the James Cooley Show. It's your life, and we got this absolutely fantastic doctor on today. But you know what? Just like I mentioned in the beginning, I think she's like 4 doctors. I mean, 4 doctors, and you know, and I can see the hat, and she wearing all of them well, you know. So, but today what we're talking about is trading pounds, you know, for head problems, and sometimes that's not always good, because especially if we don't understand the medicine or whatever they're being prescribed. And sometimes we over medicate ourselves, or we just have this thing called wonder. I wonder if I just take all this and I'm going to lose 100 pounds in the next week or 2. I mean, I just made that up. I mean, but you can be wondering about anything that you're taking. So, Doc, when we left off, you were telling our audience, I want you to reemphasize about BLM. And then we're going to go off into the next segment, and Michelle's just going to have it. So can you just rephrase that to get them an opportunity of what that means?
Yes, definitely. So what we were just talking about was, the GLP-1 drugs are FDA approved, but only for certain patient populations. So they are prescription medications. The first one that came out was Ozempic. The active ingredient is called semaglutide. It's an injectable product, and it is technically only FDA approved for if you have a BMI of 27. So that means if you're overweight or medically overweight, and you have some sort of condition like a chronic disease condition like cardiovascular disease, heart disease, or another condition that can contribute to diabetes or, any other health issues. Or you have to have a BMI of 30, which is considered medically obese. So if you have either the 27 plus another condition or 30 and above, then that's when you can have insurance cover this medication, and Ozempic can be used for type 2 diabetes patients. But there's also, with the same active ingredient at a different dose, called Wegovy, that's FDA approved for weight loss. And that is the same parameters. You have to have the BMI of 27 plus another condition or a BMI of 30 and above for insurance to cover it. That being said, there are a lot of people that don't fit into those parameters that are taking the drug. And, a lot of people see these medications as a magic bullet, that it's the right fit for everyone, and that, they're just going to take it and not have any side effects. So that's pretty much where we left off, is like a little summary of these are the sorts of medications, and they work to suppress your appetite, but they work to regulate or modulate the amount of insulin or glucagon they have in your body. And so because of that, they're really helping people to lose weight, but it doesn't mean that, they're the perfect fit for everyone or that they work without issues.
And before we start talking about the major red flags, we go over 4 of them. I just want to also add that sometimes people share medications with each other, and just because it's prescribed for your family member or friend does not mean you should be taking somebody else's medication. So I know I'm sure people do that. Do you agree with that, or?
I do think you're correct that people do that. However, they should not, because that's why a prescription is written specifically for that one person. So I would just say, as a blanket statement, like, don't take any medications that your healthcare provider or your healthcare provider team have not written specifically for you.
Most definitely. So let's talk about some of the major red flags. Let's talk about the first one, gastrointestinal issues associated with GLP-1 weight loss. Can you go into that?
Yeah, so gastrointestinal is just a fancy word for like anything related to, your entire tract of the way that you eat. So all the way from your mouth to your rectum. So, with these GI side effects, it could be nausea, vomiting, constipation, diarrhea. Those are some of the most common side effects, actually. And, we see so much of people saying that they're taking these medications, but behind closed doors, they might actually be experiencing some of these issues because they are pretty common. And the other thing is that some of these issues can actually escalate to what's called gastroparesis. And gastroparesis is all about the stomach not emptying correctly. Stomach doesn't empty correctly over time, then that can lead to issues with the way that your entire GI tract is working.
Wow. So when it leads to issues with the stomach, and sometimes, folks generally, they'll have over-the-counter medicine for their stomach issues, not thinking that it could be the drug that they're taking. So of course, if you're severely ill, we want you to go to the emergency room to your doctor, but what other symptoms are associated with gastrointestinal issues, especially taking this type of drug?
So the most common are the ones I mentioned. So nausea, vomiting, diarrhea, and constipation. The other part about the stomach emptying or gastroparesis, you likely cannot see on your day-to-day, but it's something that, what could happen over time, or something your healthcare provider can check for you with a more invasive sort of scan. But the things that you really want to keep in mind is, am I having issues with going to the restroom in any capacity? And then am I having issues with, just feeling nauseous or feeling like I need to throw up all the time? And actually, the majority of people that have stopped taking the medication soon after starting it is because they're having these GI side effects, and therefore they decide like they can't handle it.
Well, I know
doing that.
I know in general, if I'm starting to take a new medication, it can be a breakout of hives or something. I'm like, oh no, I got to get rid of it, especially when you're taking something new. So let's talk about the second major red flag: accelerated muscle loss. Now we know, as we age, muscle loss is a part of life. That's why people, when they go to the gym and their doctor encourages them to lift weights, do some type of strength training. However, let's talk about GLP-1 issues and risk involving accelerated muscle loss.
Yeah, so these drugs, the way that they work in the body, as I mentioned before, when you're taking them, you could lose upwards of 15 or even 20% of your total body weight. But what is oftentimes missed in that, exciting statistic of losing that much body weight is that part of that body weight that you're losing is, in part, it is fat, but the other part of that is muscle. And just as you mentioned, so much of the current research about longevity and about aging powerfully is about muscle. And so since the muscle is all about, staying metabolically active, and it's so essential for strength, that losing it can actually slow down our metabolism and make long-term weight management more challenging. And so muscle loss, in addition, as we age, especially 40s and above, our muscle loss can increase the risk of frailty, or it can also increase the risk of falls.
Wow. And people who have, let's say, pre-existing conditions such as osteoporosis or osteopenia, and they're taking this drug, this is just like a double or triple whammy as far as muscle loss. Can you comment on that?
Absolutely. Yes. And those are some patients that I would hope that, if you say to your healthcare provider, I would like to take this medication, that they would look into your past medical history and see that, you do have osteopenia in your chart, or you do have osteoporosis. And therefore, I would suggest that this drug or this drug class in general is not the right choice for you, because you already have so many risk factors. You don't want to put yourself at a higher risk.
How important it is before you take any of these type of drugs that contain the GLP-1 that you're upfront with your physician about your family history. I mean, you may not have high blood pressure now or diabetes now, but it doesn't mean that your mother, your father, or there's a history of it in your family. How important is it to be forthcoming with your physician if they want to prescribe that for you? You don't have any of the symptoms, but you need to tell them about the family history.
Yes, so that's what's so important about building a relationship with your healthcare provider or your primary care provider, is that hopefully that's already been discussed many appointments in the past. So it's something that they can just refer to in the electronic medical record or in your chart in general. So in short, the answer is, be as open and honest as you possibly can, because the healthcare provider is just trying to help you help yourself. And they're just trying to understand, is this the right choice for this patient? And what you don't want to do is put yourself in higher risk. I always say, the medication or the supplement or the, lifestyle choice that you are doing that your healthcare provider doesn't know about is potentially the most dangerous.
Wow. Yeah, all this information that you're putting out is so fantastic. But I tell you, we got to take a station break. We're going to take a station break, but we're going to come back because there's so much more that this great doc is going to discuss with us. And I tell you, if you want to be part of the conversation, I would make it easy for you. All you have to do is just pick up the phone and dial 1-888-344-1170. Again, that's 1-888-344-1170. My main man, Todd, answer the phone, put you through, and you can ask this great doctor any questions that you might have. Always remember, it's your life. And we'll be back shortly after the break.
There's more stories of greatness to help you overcome adversity coming up on It's Your Life with James Cooley.
Craving a slice of Chicago right here in Temecula wine country? Then dive into legendary Chicago deep dish style pizza at Rosati's Pizza Pub. Piled high with gooey cheese, rich tomato sauce, and your favorite toppings, Rosati's delivers the taste of the Windy City right to your table or front door. Enjoy the cozy pub atmosphere and an impressive selection of Temecula wines. Come on down to Rosati's Pizza Pub for your slice of Chicago right here on Rancho California Road, or order online at myrosatis.com. Rosati's, where Chicago deep dish pizza meets Temecula charm.
The James Cooley Show. It's your life. That's right.
Would never be the same. Cooley lays out his
Hello, I'm Dr. James J.C. Cooley from the United States of America, and I am here to just say, first of all, I'm so happy and honored to be honored to be in the Coffee Book 2023, Unified Brain Z and the other organizations. Thank you so much for giving me an opportunity to be a part of this collection.
or wherever books are sold.
Let's go. It's the James Cooley Show. It's your life.
Hello. Welcome back to the James Cooley Show. It's your life, and I ain't a whole lot I can say about this absolutely wonderful doc because, wow, she just showing you all about a lot of things, and what we're talking about is trading pounds for hip problems. And I'm going to mention that again in case that you are just tuning into the show. It's a lot of things. They got Ozempic. They got all of these different approved medicines for some of them are for 2-3 different things, but they're FDA approved. But if we don't understand why we are taking them, and if we don't take them for the right things and the right doses, they have been proven to work. So yeah, you're gonna lose some pounds, but what else you might lose? If you over medicate, you could lose your life, you could lose organs, you could lose a lot of these things. So I'm not gonna get off into what Doc is talking about that much, because her and Michelle is saying I was sitting back here, I'm like, wow, they having this conversation, and I'm sitting back. I pulled out my notepad and started taking notes. So, hey Doc, I do want to say, now you mentioned the name brand, Ozempic, all of these other type of things. Let's discuss off-label misuse. I mean, because they got, you already know if you come out with something, then it's going to 10, 15, 50 other different companies going to come out, and they going to come up with their brand, and they're going to be like 50% off or 7% off. And so can you talk a little bit about off-label misuse and what does that mean?
Yeah, so off-label misuse means that, when a drug is FDA approved, like what we were talking about before with Ozempic, with Wegovy, they're FDA approved for specific disease states and for specific patient populations. So again, Ozempic is FDA approved for type 2 diabetes, not as the first agent, but one of the add-on agents later down the line, especially if someone has type 2 diabetes, they're likely taking metformin. And so this could be one of the additional agents that someone is prescribed to help manage their blood sugar. And again, meaning that it's, being used correctly, it is for people with a BMI of 27 plus another condition or BMI of 30. Off-label means that it is being prescribed to people who do not fit into those two categories. And so that could be people who have a BMI of less than 27. It could be someone who has a BMI of 27 without another condition. And so that it's really important to talk about because the data that we have supports the use of these medications for those two patient populations specifically.
Hey, Doc, I got one question because you mentioned BMI 27, you mentioned BMI 30. As we know, men and women, for its body fat calculation, is differently calculated. So can you explain that from that perspective? Because if you got a guy that's 27%, 26% is considered obese, as we already know that, 27, and a woman, far as my understanding, 30% is entering obesity. So can you explain that, or is there any differences?
So what you said, so BMI of 27, that is the kind of lower end cutoff. And then the BMI of 30 is the other cutoff to distinguish if this drug is appropriate for someone. I do understand your point on men and women. Our composition in general is different. But that being said, that's just the parameter that the FDA uses. So is it perfect? No. But it works for at least what they've researched thus far with the use of the medication.
Wow. Todd, so what are your thoughts on this conversation with Dr. Swathi?
Yeah, I'm learning a lot, and a lot of people have talked about these certain medications like it's a miracle drug and stuff, but like anything else, you have to take precautions when it comes to your health. There isn't really a quick fix. So I'm learning a lot, and I'm looking forward to the rest of the show.
Wow. So, Dr. Swathi, going back, we already talked about at least the three major red flags regarding taking items that contain GLP-1, as I put it. Can you tell us about the fourth major red flag?
Yes, so the fourth major red flag has to do with mental health and potential negative mental health side effects. So what we really need to know about this is the way that GLP-1 agonists work in the body is that they can reduce cravings, and they can also reduce, the amount that we want to eat, because they can increase our fullness or satiety. And so some people who are using it in case reports say that, they have mood changes, or they have anxiety or low mood or depression. And so it's really important for healthcare providers to monitor mental health. And the other thing too is the GLP medications, they can impact the brain's reward system, or the dopamine system. And that again is tied to appetite and satiety or fullness. And so, maybe one of the things that might have given us so much excitement or satisfaction before as it pertains to food or activities we were doing, maybe that can be dampened a bit. Again, this depends on the person. It's all about how the drug is going to impact everyone differently, but these are just some of the things that we're seeing.
And exactly, I mentioned, like, actually before the show went live, we were talking about, eating disorders, and you mentioned mental health as one of the red flags, and how it is important for a patient to be upfront with their physician, especially the history, if they do have an eating disorder, how this drug may not be the best for this person, because whether they're a couple of pounds overweight, whether they're not, that maybe taking this will just elevate any mental concerns or issues that they're currently going through, or they have been going through. So what are your thoughts about that?
Yes, so I think that falls into one of the previous things we were talking about some of the misconceptions, is that, people think that this medication is the perfect choice for everyone, and I do not agree. Instead, we need to figure out, who is this the right drug for? And I think people with a previous history of an eating disorder, or someone who has struggled with mental health in the past, might not be the right choice, just given the fact that the drug works in this type of way and can impact the body in this way.
Wow. So we're getting ready to take a break in less than a minute. So what takeaways, as far as the mental health red flag, do you want to leave with the audience regarding that particular red flag?
So regarding that particular red flag, if you are interested in taking a GLP-1 agonist drug, please discuss your previous history with any and everything as it pertains to mental health, so that your healthcare provider and you as a team can decide if this drug is the right choice. Because once again, it could be the right choice, but it's not the right choice for everyone.
Thank you.
Wow. Yeah. And so, Michelle, when you get back, I want to discuss a little bit more about the mental health portion of it. The mental health side of this, because I think that our audience need to have a better understanding of what this might cause. So I tell you what, we're going to take a station break. We're going to come back, and we're going to have Michelle going to continue to narrate this along with this great doctor. And I tell you, it's not too late if you want to be part of this conversation. All you have to do, pick up the phone, dial 1-888-344-1170. Again, that's 1-888-344-1170. It's your life, and we'll see you shortly after the break.
There's more stories of greatness to help you overcome adversity coming up on It's Your Life with James Cooley.
A black man.
The James Cooley Show.
really get a chance to know who you are. And once you know who you are, you truly know who you are, love who you are. Love who you are. You're a masterpiece. Love who you are. Love who you were born to be. Love me some me. That's what I'm talking about. When you leave high school, you gotta know today or tomorrow, hopefully today, what your plans are. Hopefully, there is no bad decision unless there is no plan. Create, collaborate, commit with confidence. Commit with what? Commit with what? In everything that you do.
Remember that every donation makes a difference regardless of size. The J.C. Cooley Foundation thanks you in advance for your contribution.
Country Boy, City Boy, A Journey That Ain't Over Yet, the true life coming of age story by James J.C. Cooley. Using humor, wit, and engaging storytelling, James paints a picture about his arrival in a rural deep south town and realization that life would never be the same. Cooley lays out his struggle to adjust from city life to country life and back again, sharing his hard-earned lessons to educate, encourage, and enlighten our next generation of leaders and heroes. Get your copy of Country Boy, City Boy, A Journey That Ain't Over Yet by James J.C. Cooley, available on Amazon and everywhere books are sold.
Craving a slice of Chicago right here in Temecula wine country? Then dive into legendary Chicago deep dish style pizza at Rosati's Pizza Pub. Piled high with gooey cheese, rich tomato sauce, and your favorite toppings, Rosati's delivers the taste of the Windy City right to your table or front door. Enjoy the cozy pub atmosphere and an impressive selection of Temecula wines. Come on down to Rosati's Pizza Pub for your slice of Chicago right here on Rancho California Road, or order online at myrosatis.com. Rosati's, where Chicago deep dish pizza meets Temecula charm.
Yeah. Doctor James.
Hello, welcome back to the James Cooley Show. It's your life, and I tell you, just thoroughly enjoying this education that all of us are getting from this absolutely fantastic guest. And I tell you, we need to take heed, and we all want to lose weight quick. We always all want to do this thing. They have a magic potion pill out there, and like, oh, if I take this, I'm gonna lose the weight, and maybe you might lose some weight. But if you use that with exercise, I know, Michelle, that you mentioned that has nothing to do with exercise today. Everything has something to do with moderation, taking medicine, doing this, not over medicating, and not trading pounds for something that's not reality, and if you're not willing to put the work in. So I'm not going to take up too much more of that, because I think that the doc is educating you all. What I want to say is, wow, we've been on KCBQ AM 1170 FM 96.1 for 6 years. We've been on TV, E360 television, a lot of different, over 95 different platforms. We are asking for sponsorships so we can continue to bring you guys these great shows, these absolutely fantastic guests. And you say, okay, what do I get for sponsorship? If you sponsor my show, you get an opportunity to be on my show. You get an opportunity to promote whatever your product. Well, and not just that, but we will create a commercial that talks about your products and continue to educate our public on not just the radio, not just television, but on all of our platforms for the same price. I tell you. So if you think about doing that, all you have to do is just you can call me up personally, 817-729-6272, or go to my email, jamescooley145@gmail.com. You give your own. You can reach me. I'm reachable. Yeah. So hope you decide to be a small. So I'm gonna turn it back over to Michelle.
Thank you. Dr. Swathi, what steps should medical professionals, healthcare professionals take to make sure and to monitor the patients who are taking things that contain the GLP-1? I mean, what is going on currently, and do they need to do extra follow-up?
Yeah, great question. So I would say, if you're one of your patients, if you're a healthcare provider, one of your patients, or many of your patients likely are taking GLP-1s, it's more of how can we approach this from a whole person perspective and think about if they are taking these GLP-1 medications, what can they do in addition to support their muscle health and preserve their muscle for the long term? Because as we talked about, there are quite a few red flags and misconceptions. And the one that I think that is most often overlooked is the one pertaining to muscle health. So I always recommend, and I think healthcare providers should do the same, of like, how can we guide our patients from a nutritional perspective, a movement perspective, and a supplements perspective?
Wow. So what lifestyle changes besides, if let's say you have patients who are taking this and contains this ingredient, besides exercise, is it possible, and it depends on each patient, that certain vitamins that they're taking over the counter may counteract the effects of the specific drug?
It's possible, but rather what I like to focus on is, what supplements could be beneficial to this population who are taking the GLP-1 medication. So I have 3 top recommendations. The first one is omega-3 fatty acids. This can reduce muscle inflammation and support protein synthesis. You can get this from a supplement, but you also can get it from food like salmon or chia seeds. So things we might already be consuming on the daily. The next one is amino acids. So you can get this from a supplement as well. I really like branch chain amino acids like leucine because they help prevent muscle breakdown. And then the third one of the top, 3 supplements I would recommend is called fortotropin. It's a bit newer to the scene, but it's very highly researched. And it's actually a natural compound derived from fertilized egg yolk. And clinical trials showed that in patients who were taking this, who are not exercising, they increased muscle protein synthesis by 18%. So if you're interested in, preserving your muscle and learning more about this, there are studies, so many more studies on myosmd.com, myosmd.com. I'm also very passionate about this topic, about longevity and muscle health. So I create educational videos that are on myosmd.com too.
Wow. So thank you for that referrals. These drugs, this ingredient, these drugs, and I guess it's individualized based, but how quick do they work regarding weight loss? I mean, yes, you have to do other things as well, but what is too much at one time compared to, let's say 1 week and you start taking the drug and you lose 10 pounds. I know people talk about water weight, et cetera, et cetera. I'm talking about 10 pounds of, whether it's fat or, how much is too much? And
So
what should you be concerned?
Yeah, so likely in the first few weeks, you'll start to see a change in your body. You'll start to see some of the weight fall off, whether that's water weight, a combination of muscle and fat, all of that is very person dependent. However, likely you're not going to see in 1 week, a 10-pound muscle or, fat loss difference. So it can happen in a matter of weeks. And the way that the prescription products are, so Ozempic and Wegovy, they are set doses. So some of the dosing schedule, you take it, weekly. Some of them you take it every other week. Some, there are even ones where you take daily. And we haven't talked about this yet, but, some are injections, some are actually oral as well. So it just depends on, what is going to fit your lifestyle the best as a patient, but also like figuring out like which of these formulations is going to be the best fit too.
Yes, we talked about the injection shots as well. And, I guess whatever suits that person's lifestyle, whatever their physician is providing to them or recommending. And this individual I was mentioning to you, I mean, I would say she was only 10 pounds overweight, but she was still taking those injections. So, you know what? It really depends on who your physician, your healthcare professional is. It's important to, and you mentioned BMI before, and it's really important to do the right thing by your patient.
Yes, exactly. And what you mentioned there is off-label use. She's not in the FDA-approved patient category, but her physician decided with their clinical discretion that they would still write the prescription for them.
Wow. Okay, so we're down to like a minute, 30 seconds of the show. What is some takeaways you want our viewers and our audience to get from this conversation?
Yes. So, if you are interested in taking a GLP-1 medication, or if you're currently taking it, it's not a one and done, you just take the medication and then you're good to go. You also have to think about how you're going to support longevity and support muscle health throughout this entire process. And, the other red flags we talked about too, how are you going to support your mental health? And so, as I mentioned, it has to be a multi-pronged, multifaceted approach that is from a personalized lens. So how can you incorporate, the right nutrition, eating whole foods, small, frequent meals? How can you incorporate movement that works for you? That could be walking the dog, that could be running on the treadmill, it could be doing Pilates, anything that works for you. And then how can you incorporate the supplements to support this? So again, I mentioned omega-3 fatty acids, Misuse, and omega and branch chain amino acids. So, those.
I want to thank you so much for taking the time to come on the show. And I'd like to thank Dr. Michelle Cooley for putting together another absolutely fantastic show. I'd like to thank our studios back in California, KCBQA 1170 Answer. I'd like to thank our viewers and listeners for tuning in to the James Cooley Show. It's like always tune in Monday through Friday, 2 p.m. Pacific Standard Time, where we teach you how to dream big, think big, and be big. We'll be back tomorrow, same time, same place. It's your life.
Attention, Patriots and all.